Good morning. My name is Minnie George. I'm a MSN student in Leadership and Management at Western Governors University. As a part of my capstone project, I have developed a handoff communication tool for bedside shift report, and I'm here to present with you the key aspects of the project. Accurate and timely transfer of pertinent patient information between nurses is essential to assure patient safety and continuity of care. Handoff communication during shift changes is one of the important times of nurse-to-nurse communication. Effective and accurate shift handoff ensures patient safety, continuity of care, and elimination of preventable errors. Communication errors, including errors during shift handoff, account for more than 70% of sentinel events that occur in healthcare. Experts in healthcare such as AHRQ recommended the use of a standardized approach to shift handoff, and regulatory bodies such as the Joint Commission requiring the hospitals to implement a standardized approach to shift handoffs. Shift report at bedside promotes effective communication between patients and caregivers. Promotion of patient involvement in their own care promotes self-efficacy and adherence to treatment. Gap between the evidence and current practice. The alarming number of patient deaths and sentinel events occurred due to communication errors are well documented in literature. Poor communication is increasingly recognized as a major contributing factor in healthcare errors. Gaps in communication during handoff processes continue to exist, resulting in increased vulnerability to patient safety. To address the concerns of communication errors, experts in healthcare such as AHRQ and the Joint Commission have recommended the use of a standardized approach to shift handoffs. The Joint Commission introduced a national patient safety goal that requires hospitals to implement a standardized approach to shift handoffs. The gap between the evidence and the current practice. An extensive review of literature and study of 30 peer-reviewed articles in depth on shift report, bedside shift report, and handoff communication tool were conducted. The three main themes emerged on literature review were handoff communication using a tool during shift report, importance of standardizing the tool, and adding bedside component in shift report. Research shows that implementing a standardized communication tool reduces the risk of transmitting inaccurate and incomplete information. Out of the many handoff communication tools reported in literature, the SBAR framework, that is the situation, background, assessment, and recommendation, is very prominent and widely used for shift handoffs. The SBAR protocol provides a concise and prioritized structure that enables consistent, comprehensive, and patient-centered reports. There are numerous benefits of bedside shift report. It encourages patient and family to be actively involved in their care, which enforces self-efficiency and adherence to treatment. Being a level 1 trauma center in the Mid-South area and serving the radius of 250 miles of population, the patient turnover rate is very fast at Region of One Health. Multiple staff take care of one patient during various shifts, so the communication has significant role in continuity of care and patient safety. Region of One Health Memphis, Tennessee uses SBAR communication method, but there is no standardized handoff communication tool for shift reports. Development of a communication tool for bedside shift report was identified as a quality improvement project to ensure continuity of care and to increase the patient safety at Regional One Health. A handoff communication tool was developed and implemented in the Medical Surgical Unit of Regional One Health, Memphis, Tennessee. A practice change within the organization was noted with the implementation of the capstone project. The standardization of the tool led to consistency in handoff communication during shift report. The capstone project also led to improved patient safety and patient and family satisfaction. Process to develop and launch capstone project. The need to develop a handoff communication tool for shift report emerged from the meetings and discussions with the unit manager, unit educator, preceptors, and other peer members working in the unit. The unit manager, educator, and nurses on the unit embraced the idea of a standardized communication tool for shift report, which was selected as the capstone project. An organizational approval for the capstone project was obtained from the Vice President of Inpatient Services. After obtaining the organizational approval, the next step was to secure a preceptor for the project. The unit educator who can give advice and guidance during the project agreed to be the preceptor for the project. After obtaining the organization approval and securing the preceptor, an extensive review of literature was done. More than 45 articles related to nursing shift handoff, standardizing shift handoff, handoff tools, and bedside handoff were reviewed, and out of that, 30 articles were selected for more in-depth study and review. The main ideas from the literature were synthesized and outlined. Additionally, different communication tools used in different departments and other hospitals were also collected. A handoff communication tool was developed with the help of all the above resources and presented to the nurses, nurse manager, IT staff, and the unit educator for the review and input. Changes were made to the tool after receiving all input, and the tool was finalized, and permission to use the tool was obtained from the unit manager. The tool was presented in the safety huddles, staff meetings, and displayed in the PI board. The nurses were educated on the importance of a communication tool for shift report, supporting literature evidences, use of the tool, and contents of the tool using a PowerPoint presentation in the staff meeting. The importance of consistency in using the tool was well explained. The whole project was completed and implemented in 8 weeks' time. The tool was uploaded to the desktop in the unit for the staff to use it. Let's see the successful aspects of the capstone project. The overall process of development and implementation of the standardized handoff communication tool for shift report went very well. Through the project, the student could improve the staff awareness and understanding on the significance of bedside shift report and the use of a standardized communication tool for it. Nurses improved their awareness on importance of involving patient and family in the shift report by doing it at the bedside. The tool encouraged the nurses to conduct the shift report at bedside. The tool helped the nurses to pay more attention to the patients than transcribing the patient information during shift report, which led to increased patient safety, quality of care, and patient and family satisfaction. Another successful aspect of the project was that the tool was introduced to other departments and units, which motivated them to develop their own unit-specific handoff communication tool. Readiness among the staff to commit to the practice change of doing bedside shift report using a standardized tool was observed throughout the implementation stage. Another success of the capstone project was that it helped to strengthen the trans-professional relationships in the unit and in the institution. The project helped to realize the importance of trans-professional relationships in any innovations or quality improvement projects within the organization. The project improved patient safety, patient and family satisfaction, and their participation in care, leading to better health outcomes and improving the HCAP scores. How success inform future projects? From the success of the project, it was learned that Similar evidence-based quality improvement projects can be initiated and implemented in the unit and other areas of the hospital. The capstone project was a groundwork in the unit for future practice change projects. The project was a motivation for the other staff members to develop similar quality improvement projects. The student learned that transprofessional relationships has an important role in the success of any quality improvement projects. Multiple stakeholders with different expertise and backgrounds are important for successful implementation of any projects in the organization. It was also learned from the project that researching and studying a problem to find the best practices can lead to practice change, quality improvement, or innovation, resulting in improved patient care outcomes. Aspects that did not go as well as anticipated. All aspects of the project went well as planned except the timeline. The project was anticipated to be completed in 6 weeks but was completed in 8 weeks of time. The organizational approval was obtained almost after a month, whereas the timeline for that was 1 to 2 weeks. As there was a time constraint to complete the work after the organizational approval, the student had to work extra hours on the project for its earliest completion without any further delay. How it informs the future projects. The organizational approval for the project took longer time than planned, which delayed the project completion by 2 weeks. So in future, when planning for any quality improvement project, all attempts will be done in obtaining the institutional approval at the earliest with regular follow-up. Extra time will be allocated for any unanticipated occurrences. Transprofessional support is an important factor in timely completion and success of any project. Flexibility of the team members should also be considered while selecting the team members for any project. The team leader's acceptance and influence on the group also affects the success of the project. Plan to support post-implementation. The success of any quality improvement or innovation project depends on maintaining its continuity and follow-up of the project. The short-term goal of maintaining the staff compliance in using the handoff communication tool was achieved by continuous reminders, encouragements, and observations of the staff during the shift handoff time for their compliance. During the safety huddle at the beginning of each shift, the huddle coordinator reminded staff to use the communication tool for shift report and conduct the shift report at the bedside. The compliance to the use of the tool was monitored by charge nurse on each shift on a daily basis. The unit manager and the educator did random visits during the shift changes to ensure compliance to bedside shift report using the communication tool. The unit clerk on the previous shift made sure the availability of the communication tool in the unit for the oncoming nurses to use it. The long-term maintenance of the project was achieved by developing a policy and protocol to use the handoff communication tool during bedside shift report. The IT department was contacted to incorporate the shift report with patient education records and make it available to print. The training and development department was contacted to include the handoff communication tool and bedside shift report as an annual competency for medical surgical nurses. The communication tool was introduced to the new employees during the orientation time. The preceptors were trained to train the new nurses on the importance and use of handoff communication tool during shift reports. Let's see the resources needed for post-implementation support. Staff compliance was the most essential requirement in sustaining the project. The unit managers and unit educators' role in giving continuous staff support was very important during the post-implementation stage. The administrative support was obtained through their approval in making a policy and protocol to use the handoff communication tool during shift report. The effectiveness of the tool was evaluated through ongoing meetings with the staff, manager, and unit educator. Staff complaints was measured by direct observations and report from the charge nurses and other staff. IT support was another valuable resource during post-implementation stage. The unit educator and IT helped to place the handoff communication tool in the orientation package and as an education module for annual competency. Desktops where the communication tool is available, printer and paper were the other resources needed for the post-implementation support. Let's see the integration of MSN program outcomes. By developing a handoff communication tool for shift report, the master's prepared nurse could implement a practice change towards quality improvement in the organization. The capstone project enabled the integration of all 9 MSN program outcomes. Improved patient safety and patient and family involvement in their care were the most successful outcomes of the project. The 2 most relevant outcomes of the capstone project were utilizing applied research outcomes for integrating care services and scientific findings from nursing for improved nursing care. Let's see the utilizing applied research outcomes for integrating care services. Extensive review of literature and study of the research outcomes related to the use of standardized communication tool for shift report revealed the importance of communication tool in reducing patient harm related to medication errors and miscommunication and increasing patient safety. This research findings motivated the MSN student to develop a communication tool to use for the handoff communication during shift report. This leadership activity brought changes in the nurse's behavior of doing bedside report at nurse's station and moving it to bedside. The bedside shift report increased the nurse-patient relationship, nurse's satisfaction, and patient and family involvement in their care. Patients expressed their satisfaction in participating in the shift report and their involvement in their care to nurse manager in her daily rounds. Scientific findings from nursing for improvement of nursing care. The MSN program outcome of assembling scientific findings in nursing from a diverse setting was accomplished by the extensive review of the literature performed for the capstone project. Over 40 articles were reviewed and 30 were selected for in-depth study. The articles reviewed included that from culturally diverse countries such as USA, Canada, and some Asian countries. The evidence-based research was utilized in developing a handoff communication tool based on SBAR framework. The capstone implementation accomplished an increase in patient safety and a decrease in undesired patient outcome that can happen due to communication errors or inadequate communication. Standardization of the tool was consistency in shift report was also achieved by the capstone project, which promoted high-quality patient care delivery. The capstone project motivated the nurses to conduct bedside shift report, which was an accomplishment as the compliance was always very poor prior to the capstone project implementation. The capstone project enabled the student to construct a strong interprofessional team towards patient safety and improving quality patient care. Thank you.